Hey there, folks. Welcome back to our channel. Today, we're diving into some fascinating insights brought to us by a recent study conducted by the Centers for Disease Control and Prevention, or CDC. We'll be discussing long COVID and significant activity limitation among adults, a topic that has captured a lot of attention since the onset of the pandemic. So, grab a snack, settle in, and let's get started. To put it simply, long COVID refers to a range of persistent symptoms that stick around even after a SARS-CoV-2 infection. These symptoms can include things like respiratory issues, neurological problems, cardiovascular complications, and more. The study's estimated incidence of long COVID among non-hospitalized adults with COVID-19 spans from 7.5% to a whopping 41%. As you can imagine, the impact of long COVID on the healthcare system is significant. A retrospective cohort study found that people who tested positive for the virus had a 4% increase in healthcare utilization over the 6 months following their positive test result. That's a lot of strain on the system. But that's not all. Long COVID can also greatly affect the quality of life, functionality, and ability to work for those who are afflicted. A study from Australia even highlighted that long COVID was responsible for a staggering 74% of the years lived with disability caused by SARS-CoV-2 infections. So, who's at a higher risk for long COVID, you ask? Well, it seems that adults aged 50 and above, who've had more severe acute infections, might be more prone to experiencing it. But here's the kicker: the link between age and the risk of long COVID and significant activity limitation isn't fully understood. Now, let's talk about the study itself. The CDC analyzed data from the Household Pulse Survey, which looked at trends from June 2022 to June 2023. This survey aimed to measure the social and economic effects of COVID-19 on U.S. households. Questions about long COVID were added to the survey in June 2022. Respondents were asked about their COVID-19 history and any current long COVID symptoms. Starting September 2022, they were also questioned about substantial activity limitations due to long COVID. Now, let's get to the juicy part, the results. The study found that the prevalence of long COVID among all U.S. adults decreased from 7.5% in mid-2022 to 6.0% in mid-2023. Interestingly, the decline stabilized after January 2023, and the most noticeable decrease was observed in adults under 60. For those who've had a previous COVID-19 infection, the prevalence of long COVID dropped from 18.9% to 11.0% during the study period. It's quite the shift, isn't it? And here's the kicker: during June 2023, around 26.4% of adults with long COVID reported substantial activity limitations. This number remained stable over time. But what's really intriguing is that the prevalence patterns of these limitations didn't seem to follow a clear trend across age groups. So, what do all these findings mean for us? Well, for starters, the prevalence of long COVID seems to have stabilized after an initial decline. This serves as a powerful reminder of the importance of continued COVID-19 prevention measures. And if you're someone experiencing substantial limitations due to long COVID, know that you're not alone, and support services are crucial. These insights could also have implications for healthcare planning and disability policies. And remember, folks, the fight against COVID-19 is far from over. Staying up to date with recommended vaccinations and following prevention guidelines is still key. That's a wrap on our breakdown of the CDC study on long COVID and significant activity limitation among adults. As always, if you found this information valuable, don't forget to like, share, and subscribe for more science-based content. Thanks for joining us today, and stay safe out there.